Okay, welcome everyone. Welcome to the Indonesia Project Global Webinar on COVID-19 Outbreak. I'm Arianto Patunru, together with Nurkamala Mulyani and Baskara Juwena. This program is supported by the Australian National University and the Australian Department of Foreign Affairs and Trade. In the past 5 webinars, we have looked at the experience in different countries in handling the pandemic. And today, we're turning our attention to the regions in Indonesia. With us today are 2 speakers. The first one is Dr. Sudirman Nasir. He's a public health expert at Universitas Hasanuddin, who studied in the University of Melbourne. He will be discussing the COVID-19 in South Sulawesi. The second speaker will be Dr. Saiful Mahdi. He's an economist at the Universitas Syiah, Kuala. He is a graduate from Cornell University, and he will talk about the situation in Aceh in terms of this COVID-19 outbreak. So let me first invite Sudi, my friend, I call him Sudi, to start his presentation. Time is yours, Sudi.
Okay, thank you, Dr. Arianto, Patunru, my friend, Acho. And I would like to discuss some latest development in terms of COVID-19 in South Sulawesi, particularly the trends in the last 2 weeks since the implementation of the large-scale social restriction policy in Makassar, the capital of South Sulawesi. I will start with refreshing our knowledge about South Sulawesi. So we can see in the next slide. South Sulawesi is located in the central part of the Indonesian archipelago. And in 2019, there are more than 8 million, almost 9 million people, and predominantly Muslims living in this province. And Makassar, the capital of South Sulawesi, is an old and largest city in the central and eastern part of the country. And it is important to take a historical perspective to see Makassar's strategic location in terms of trade in the archipelago. Makassar is a port city that strategically linking the western part of Indonesia to the central and eastern part of Indonesia. So since centuries ago, this city is always a busy and lively city. In 17th century, the Dutch East India Company, or the VOC, occupied the city, particularly to safeguard their route to Moluccas Islands for spice trade. And after the Indonesia's independence, Makassar is again become the capital of South Sulawesi province, and it is always indicated with high economic growth, higher than the national growth, but at the same time also indicated with high inequality. Makassar and South Sulawesi is among the most unequal city and province in the central and eastern part of Indonesia. And in terms of public health measures, we should take into consideration the 2018 Indonesia's Basic Health Survey that clearly demonstrated the double burden of diseases, or the combination between communicable diseases and increasingly important non-communicable diseases such as diabetes mellitus, cardiovascular, and cancer. And particularly diabetes mellitus and cardiovascular, we will discuss later that these two are among the most important comorbidities related to COVID-19. In the next slide, I will also discuss some of the latest trends in COVID-19 in Indonesia. As you can see in the graph, that South Sulawesi experienced a very exponential growth in the last 2 months, and it is the largest epidemic outside Java. Until yesterday, it was recorded 640 confirmed cases, and there were 45 deaths. And the good signs is there is an increasing number of recovered patients, more than 200. And it is also important to remind ourselves that, of course, this official data is an underreporting of the actual data on the ground. And following also the trend at the national level, we managed to identify the most vulnerable groups in terms of sex or gender and in terms of comorbidities. We found that men, particularly those between 30 to 59 years old with important comorbidities such as diabetes mellitus, cardiovascular diseases, and chronic lung diseases, those who are more susceptible to severe clinical symptoms or even death. And the underlying of this diabetes mellitus and cardiovascular diseases are hypertension and obesity. And also we should remember when we mention the more vulnerability of men, considering the high rate of tobacco smoking in the country. And the COVID-19 cases is found in almost all districts and cities in South Sulawesi at the moment. Only 3 districts so far who did not documented and recorded cases, but it is also most likely due to the low rate of testing in those localities. In the next slide, we can see some development in terms of policies. From 24 of April to 7 May, so tomorrow, there is an implementation of large-scale social restriction in Makassar. And Goa district, it is a neighboring district of Makassar, also start to implement the large-scale social restrictions yesterday. And it is still very hard to measure precisely the effect or the impact of these policies because of low level of non-compliance to the policies. We should take into consideration at least 2 factors. One is the large number of people working in the informal economy in Makassar that hinder them to adhere or to comply to this policy, and also the fact that it is a holy month of Ramadan at the moment also partially contribute to the low level of compliance to the policy. But in the last 1 week, we start to see the increased assertiveness of law enforcement agencies in Makassar to implement and to provide punishment for those who do not comply with the policy. In the next slide, I will invite you also to discuss one of a risk factor that may provide serious threat to the spread of COVID-19 from Makassar to the hinterland of South Sulawesi, which is the traditional or the cultural ritual of mudik or going home during the holy month of Ramadan and few days before the celebration of Eid Fitr. And at the moment, it is also combined with those people who experience economic hardships in urban areas, either in Makassar or in other big cities in Indonesia. And they choose to going home to their hometown or to their villages in search of an environment with lower course of daily lives, and also due to the presence of social safety net provided by their extended family in their home or in their village or in their hometown. The combination of these two factors will have an impact of the increased number of people who return to their villages in several, in 24 districts in South Sulawesi that will potentially facilitate the further spread of the virus from the capital to the hinterland of South Sulawesi. In the next slide, I will discuss some of the recent trend in terms of improved coordination between provincial and city or district governments in Indonesia to reduce the spread of the SARS-CoV-2, especially in facilitating a more assertive policy in Makassar to reduce people's mobility from Makassar to the hinterland. And at least there are two cities in South Sulawesi who play a crucial role as a buffer zone from the urban areas to the hinterland of the province, which is Makassar and also Parepare, about 3 hours from Makassar in the north. Those two cities are the largest port cities in the province, and so far, large-scale social restriction is already implemented in Makassar, but not yet in Parepare. Parepare is a gate to South Sulawesi, particularly from Kalimantan, and there is a high intensity of people mobility between particularly East Kalimantan and South Sulawesi through the port of Parepare. And historically, these two large port cities play a key role in the dynamics of the Spanish flu in the early 20th century. So these two cities play a crucial role in preventing the further spread of COVID-19 to the hinterland. And if they fail, hopefully not, there is a possibility that we are going to see a similar pattern with the Spanish flu in 1918 to 1920, as we can see in the next slide. Spanish flu in the early 20th century in Makassar provides some valuable lesson learned. There are increased body of knowledge about the level of severity of this pandemic to the East Indies, but also to regional areas outside Java, including Makassar. Several literature documented that thousands of people died due to the Spanish flu epidemic in more than 100 years ago. And we can see in the picture one collection of Tropen Museum in the Netherlands, the port of Makassar. The Spanish flu come to the city and later penetrate into the hinterland through this strategic port. So we can say that Makassar port is a gate of the Spanish flu epidemic in the previous century. And we can see also in the next slide that because of limited anticipation in Makassar, Spanish flu spread further to the hinterland of South Sulawesi, including to Toraja. Nowadays, from Makassar to Toraja, the famous tourist destination, take time around 9 to 10 hours by bus. But Toraja has the best record about the severity of the Spanish flu in the early 20th century. It was reported that approximately 3,000 people died due to Spanish flu in this highland area in South Sulawesi. And until now, many people in Toraja, particularly the elders, still remember this Spanish flu severe impact. And they document it in their oral history. They call it in a local term, in Torajan term, as rababiang. It is a term that they describe to illustrate the massive dying of plants hit by severe wind, to get some illustration about the severity of the Spanish flu in these localities. Perhaps due to the big influence of the missionary in Toraja, documented in Batavia or in Amsterdam, they influenced the better record about the impact of Spanish flu in Toraja compared to other area in South Sulawesi. In the next slide, I will provide some tentative conclusions, because it is still actually too early to provide a very fixed conclusions in the current state. We can at least say that South Sulawesi is severely hit by COVID-19. It is the largest epidemic outside Java. And the good news that there are several policies are in place, including the large-scale social restrictions, even though the impact of this policy is still questions. But there are already several good signs, including the increasing assertiveness of law enforcement agencies, and also the increased number of recovered patients in South Sulawesi, particularly in Makassar. As we have discussed in the previous slide, there are already 200 patients who are recovered due to the increasingly coordinated programs between the provincial and the city governments, and the crucial role of our health system to provide healthcare to the confirmed cases, and also to the patients under surveillance. And in terms of containing the spread of COVID-19 to the hinterland, Makassar and its surrounding districts such as Goa play a crucial role to reduce people's mobility from the urban areas to the rural areas, and also to reduce the risk of the transmission of COVID-19 to the hinterland. In the last 1 week, we found several new cases in several districts such as Bone and Sinjai due to people mobility from Java to South Sulawesi. So Makassar will have to increase their alertness to provide isolation for those who come from other islands and plan to continue their travel to the hinterlands. And the Spanish flu in the early 20th century provided valuable lessons learned, particularly in programs or policies to restrict people's mobility from the urban area to the hinterland of South Sulawesi. And in the I will finish my presentation to also address the crucial role of non-government organization, including religious organizations in South Sulawesi to provide and to facilitate a better compliance to the government's policies in terms of large-scale social restrictions. For instance, in the current holy month of Ramadan, there are still several mosques who continue to organize praying, the night praying or the Tarawih. Even though the large and mainstream Islamic organization in Indonesia, including in South Sulawesi, already announced their advice to encourage people to pray at home. And one last thing that I would like to also emphasize, the good signs of a high community participation in providing aid, in organizing a fundraising for donation to provide assistance such as food and basic necessities for vulnerable groups in a city of Makassar, including also in the early days of the epidemic in South Sulawesi, to provide protective aid for health workers in several big hospitals in Makassar. So there are still worrying challenges, but there are also some good signs, and hopefully these good signs will grow bigger and bigger in the next coming weeks. Thank you.
Thank you very much, Sudi. That's very rich and informative. From Makassar, we move westbound to Aceh. So let me invite Bang Saiful to start his presentation. You're still muted, Saiful. Yeah.
Yes. Good morning, everyone. Thank you, Pak Achok, and thank you, ANU Indonesia project, for having me for this great webinar. Let me put my okay. So once again, a very good morning to everyone from the northern tip of Sumatra, here in the westernmost province of Indonesia, in Aceh. Thank you for ANU Indonesia project for having me in this global seminar. I will sketch a bit about response to COVID-19 pandemic in Aceh. Really actually questioning based on our experiences from the conflict and tsunami in 2004, to see actually how local is local to best respond to a disaster. I think my first take is that maybe everybody who follow Indonesian news, especially for us here in Indonesia, to see the TV broadcasts and newspaper discussing about different policies from different actors at the national and provincial levels all over the countries. Is basically, it's very noisy. It's a lot of discussion and debate, and policies, proposes, and policies being adopted and then being abandoned, being neglected, and so much so, it's actually it reminds us about the response of the Acehese communities to the protracted conflict and then the tsunami of 2004, which, based on many already studied the case, saw really the community-based kampung or village level intervention seems to be again in action compared to so many plans and policies that's been drawn at the national and provincial level. I'll come back to that a bit at the end of my presentation. But let me start with a brief overview of cases of COVID-19 and responses in Aceh. By mid-March 2020, there are so many COVID-19 so-called task forces are formed at the provincial, district, and even at the universities. And even our local parliament, Aceh Parliament, also have their own COVID-19 task force, claiming that they want to oversee the local executive government in dealing with this pandemic. And following the national policies, there are a lot of campaigning to study and work from home, physical distancing, limited public gathering, and avoiding crowds. But not until March the 23rd did Aceh has its first confirmed case of an executive from a big national company based in Aceh, but just returned from traveling in Bogor and Surabaya and several other cities in Java. And then when he returned to Sumawe in North Aceh, he got these symptoms and was treated by local hospital there, but then transferred to our general hospital in Banda Aceh, the capital of the province. And then tragically, the first confirmed case in Aceh, also the first death, actually a week from the confirmed case. From the case was confirmed. And the case was confirmed with the by the national lab in Jakarta. We think because of this first confirmed case, and then more pressure from the local communities, then Aceh government take more actions. And on March 29, the Aceh provincial government declare a curfew from it should be 8:30 p.m. to 5:30 a.m. So from 8:30 at night to 5:30 in the morning, all over Aceh, not only in Banda Aceh. And the provincial government initially planned to have this curfew until May the 29th. See, about 1 month. No, it's not March, April, about 2 months. About 2 months, and it was enforced by the police forces and also supported by the military. On the March 31st, also the Aceh government also announced that it's allocating 118 billion Indonesian rupiahs. I think it's about 12.8 million Australian dollar. It's supposed to be Australian dollar. And by April the 4th, the curfew that was planned to last for 2 months was actually lifted due to public objection. The public objection was due to some complaint that was not an effective measure, but many more complaints about the curfew has been affecting small business operating at night. You know, penjual nasi goreng vendors, and all these small vendors, mostly operating at night, suffered from this curfew. And some civil society organization also voiced out the issue of trauma of the conflict, having curfew, night curfew, like what we had during conflict in Aceh. On the 21st of April, also due to the complaint by the public that Aceh government is not allocating enough budget for COVID-19 response, while Aceh is considered to have enough budget from its special autonomy fund. Somehow on the April 21st, the government, actually from the central government, but was amplified very much by the local government, the provincial government in Aceh, that the budget for the COVID response in Aceh is now amounted for 1.7 trillion rupiahs. I think it's about 1.8 billion Australian dollars. It is the fifth highest reallocating of the provincial budget in Indonesia. The first being Jakarta, the capital city, and West Java, East Java, and Central Java, all provinces in Java with population more than 30 millions, while Aceh has only about 5.3 million people. But somehow the government decided that Aceh COVID-19 response need 1.7 trillion rupiahs. While the central and the provincial government basically said that the funding is supposed to be allocated for three purposes. Of course, for the health intervention, and then also for the buffering the economic impact, and then for social safety net. But the public in Aceh, especially civil society organization, has been voicing their concerns that now that it was officially declared that we have so much funding for COVID-19 response, but so far people are complaining about the Aceh government doesn't have no clear action plan, and there is no transparency on what to be done with the funding, how much for what, and to be and for which beneficiaries. In regard to the cases in Aceh, actually it's not as severe as other provinces. Maybe we are among also the few last provinces that have confirmed corona cases. In Aceh, by yesterday at 3 p.m., a government official announcement, we have 15 confirmed cases, and there's only one death so far, and 9 already recovered, and then some 5 are still in hospital for the treatment. So we have 1 confirmed death from the COVID-19. And most of these positive cases, well, I would say all of the 15 cases actually imported since the first one. And then several additional ones after the first ones come from the cluster of the Goa cluster, the one that the Tabligh Jamaah meeting in Goa in the South Sulawesi. And the last 6 confirmed cases actually also come from the Magetan East Java cluster. These are Achanese youth learning in the pondok, in the pesantren in Magetan. So the last 6 confirmed cases are actually from the Magetan cluster. So most are actually, if not all, most are imported cases. We have quite a number of people under observation or under monitoring, or we call it ODP. Mostly these are Achanese youths returning from abroad, especially Malaysia, and some actually undocumented migrant workers try to return to Aceh from different paths, from all small ports, not only official ports. Okay, let me see. So our university, Universitas Syiah Kuala, has been active and has its own task force to work together with the local government, and especially our Disaster Mitigation Research Center, TDMRC, also following and mapping the case. And as you can see from the map, maybe first here at the bottom is actually the case in Aceh is slowly increasing. It's very slowly, but increasing anyway. And most cases has been, confirmed cases has been reported from the northern most populated area of Aceh, like in Banda Aceh and
Saiful, are you still there? Saiful, you're frozen. While waiting for Pak Saiful to be back on the line, let's start answering some of the questions that can be answered by, I think, Sudirman. So let's start. Sudi, are you ready for? Oh, let's see. Pak Saiful, you're muted.
okay.
Okay.
Shall I continue?
Yes, please. We can help you with the slides from our side if you want.
I should be able to manage this. Let me see. Okay. Sorry for I was disconnected.
Okay, silakan Pak.
All right. So that was the cases and limited response from the government. In terms of economic growth, it is just yesterday our local official BPS Statistic of Indonesia just released the new release on economic situation, and we do see lower GRDP growth in this first quarter, of this year. Based on year, is Aceh's growth is now 3.17, and quarter to quarter is minus 4.55. And based on that, Aceh is actually, while it is on year, it's not really the worst in terms of GDP growth, but the quarter to quarter, as of now, Aceh is the lowest in Sumatra. And before I show you the before I show the community initiatives, it's really struck me, especially because I've been also studying the community level intervention in Aceh during and after the conflict, and then after the tsunami. During the conflict and the tsunami time, people are observing that the government was actually also paralyzed, as well as most of the communities in Aceh. But now it seems that the case remained the same, because there is a big question of what level of intervention, which government level of intervention is actually most effective. While there's a lot of noises and debate and discussion at the national level, also at the provincial level, and at the district level, the kabupaten and kota, the city and the district levels, government based, at least as I can portray it from the media and the social media. The initiative, the real initiative is actually coming from grassroots community level. In Aceh, is at the village or gampong level. And this is a kind of like paradox, because before we learned that maybe the grassroots and the community level intervention was active because the provincial, the district government was paralyzed during conflict and the tsunami. But as this pandemic is widespread all over Indonesia, and we have the national government, and Aceh is now in relative peace, meaning that we have a running government, but still general observation from the public will say that really community-based village gampong, or and I think this is also what happened if we see the national media reporting confusion at the national and district level and provincial level, while actually people in Java, in their desa and RT and RW already mobilized. That's very much also the case, if not more, in Aceh. And I think from the post-conflict and post-tsunami experience, we do see a lot of new studies emerging, theories about community resilience to be should be the focus of intervention also for this pandemic. This is some example of how by very early, while even mid-March, before the government having this different task force, communities in Aceh, especially in Banda Aceh and Aceh Besar, has already taken care of the own situation of their village and fellow villagers by blocking their village, locking down their village, they call it. And not only just locking down, but also mobilize the villagers themselves, so for self-help, to make sure that everyone in the kampung has their basic necessities. But of course, also as indicated by many studies in post-conflict and post-disaster, post-tsunami Aceh, it's really varied by kampung to kampung, especially due to leadership style. So leadership is the key point, whether a village or a community is taking action into their hands and not waiting for more debates and not waiting for government intervention. And in Aceh, also the pandemic is actually quite well known, especially in the older generation. We call it ta'un. In Acehese, is from Arabic ta'un, and it's been documented in the 18th century by Hugronya. And there are some people here in Aceh also doing some cultural intervention by Syiah or spreading traditional songs about this ta'un, about this pandemic. I think I will stop there and would love to have a discussion further.
Thank you so much. Thank you, Bang Saiful. It's very interesting to note that both speakers, when discussing how people respond to disasters, they both drew a comparison and lessons with previous disasters. In terms of Pak Sudirman Nasir, when discussing South Sulawesi, he drew comparison with how people responded to the Spanish flu in the early century. And Saiful drew comparison with response to tsunami. So let's now go to the question and answer. I see there a question. I think it's a very interesting question, and probably this can go to Sudirman. This is from Duncan Graham. If he was asking if people are aware of the apparent link between smoking and COVID-19 deaths, and if so, is it likely to lead to a future reduction in tobacco use?
Yeah, it is a very interesting question, since differing from the global trend in which the most vulnerable group in terms of age cohort are the elderly. In Indonesia, we found that those at the younger age cohort from 30 to 59 are the most vulnerable one, followed by people between 60 to 70. But in terms of gender segregation, it is male. And one possible important explanation for that is the high rate of smoking, tobacco smoking in Indonesia. If we see the previous or the latest Indonesia's Basic Health Survey, we see that Indonesia is among a few countries in which smoking initiation is still increasing. So the number of young smokers and smokers among adolescents are still increasing in Indonesia. And it is also followed by the trend of two important risk factors, which is hypertension and obesity, that link to two important comorbidities. in which diabetes mellitus and also cardiovascular diseases. The link between tobacco smoking and cardiovascular diseases and hypertension is well established in medicine and public health study, as well as the link between tobacco smoking with chronic lung diseases. So we can see some biomedical explanation between the high rate of smoking, and in Indonesia's context, it is mostly among men with the comorbidities. The more challenging questions is related to the latest one, whether this COVID-19 epidemic will lead to the reduction of tobacco smoking in Indonesia, or to the increased assertiveness of anti-tobacco policy in Indonesia. It is difficult to answer at the moment, since the government, particularly the national government, so far are very reluctant to employ a more progressive policies regarding tobacco limitations. As many of us know, Indonesia is among a few countries who do not participate in the convention against tobacco. Very few countries in the world who did not participate in this convention. So let's see, hopefully this COVID-19 will provide more pressure to the government to employ a better and a more assertive policies for tobacco.
Thank you, Sudi. So let me go to a question directed to Pak Saiful. This is from Hannah. Do you really believe the virus is spreading slowly, considering what we know about how infectious it is? Silakan, Pak Saiful.
Yeah, thank you, Hannah. Oh, well, I'm sorry, maybe when I said slowly, well, the case in Aceh is not as widespread as in other provinces in terms of the number, and also in its, what do we say, prevalence. There are many weeks that we don't have confirmed case, but like in other part of Indonesia, I would say that it might be due to underreporting that we don't know for sure. And we do have some rapid tests as announced by the government, but it was done not until I think the second week, the second half of the April, and that's why maybe we don't have a very steep increase in number of confirmed cases. And actually, the last confirmed cases, the 6 last confirmed cases is actually disturbing, because if you see while maybe other provinces has been seeing the decreasing trend, in Aceh is actually, although it's not every day, there's no confirmed case every day, or even 1 week was passed without any confirmed case. But once we have this last 6 confirmed case from the same cluster, it was actually disturbing. But well, I'm not health specialist, so I'm maybe Pak Sudirman and other can answer on that. But in Aceh, what I mean slow is well, our population is not as big. It's 5 million, and the capital of Banda Aceh have 250,000, and most cases actually coming from Acehnese or non-Acehnese traveling to Aceh.
Thank you, Pak Saiful. There is a question here from Pak Terry Ha that is also voted by 3 other persons. So maybe Pak Sudirman can take this first, and later Pak Saiful maybe also can add something. So Pak Terry is asking about the fatality rates. Seems to him that both Sulawesi Selatan and Aceh have recorded case fatality rates of near 7%, while in many other countries, the case fatality results are around 2%. So how confident is the government in the coverage of testing? Should they publish adjusted case number rather than just confirm numbers? Okay, Pak Sudirman.
Yeah, thank you, Pak Terry. The higher case fatality rate in Indonesia is, of course, alarming. And there are several possible explanations to the case. As I have mentioned a few times, that the increased risk factors that may contribute to important comorbidities, particularly diabetes mellitus and cardiovascular, should be taken into account. As I have also mentioned, that the latest Indonesian Basic Health Survey put these two non-communicable diseases at the top of the list in Indonesia, overtaking non-communicable diseases such as lung tuberculosis. And the risk factors related today are two, which is obesity and also hypertension. And we saw through the Indonesia's Basic Health Survey that this obesity and also hypertension increase sharply both in urban and rural areas. And also we can see that this also increasingly happen among the lower middle class and among the poor. I think these two risk factors may partially explain the fatality rate, the higher fatality rate in Indonesia compared to other countries. And in terms of the level of preparedness of our health system, I think we can see that Indonesia's health system at the national and local level are more ready and responsive to communicable diseases rather than to non-communicable diseases. Only in a few years, we start to see more and more discussion in relation to risk factors for non-communicable diseases, and also a starting of increased training for health workers to address these risk factors. For instance, in several regions, we start to see the community outreach program called Posbindu. Posbindu is actually a community outreach program focusing on non-communicable diseases such as cardiovascular diseases and diabetes mellitus. Previously, we have a different kind of community outreach, which is Posyandu, focusing more on maternal and child health and also communicable diseases. So there are two trends here: the increase of risk factors related to non-communicable diseases, two of them very closely linked to COVID-19. And also the level of preparedness of our local system to anticipate the non-communicable diseases. We need experience of other countries who managed to lower the case of obesity, such as Australia, to be adapted in Indonesia's context. So actually we are talking not just about addiction to tobacco in Indonesia's context, but it is also addiction to sugar that may contribute to the higher death rate related to COVID-19.
Yeah, but Pak Sudirman, there is a point also there in Pak Terry's question. He was wondering if the true mortality rate in Indonesia was that lower number, was that lower number? So he was wondering if it implies that confirmed cases are major underreported, under-remunerated in Indonesia. Do you have a take on that?
Yes,
okay.
I think it is widely reported that Indonesia is a country with the lowest testing ratio. compared to other countries. It is only around 300 tests compared to thousands tests in a country like Australia per 1 million population. And also, I think I need to emphasize the increased pressure from medical and health organizations in the last 1 week to advocate the government to also release the number of dates for patients under observation. And several provinces and cities start to report the dates, including South Sulawesi and Makassar. I think by announcing the death rate among patients under observation, we can see a much closer estimation to what actually happened on the ground.
Okay, thank you. So let me now move to other questions. I think you answered Terry's question already. So let me combine questions from Kim, Noble, and Ben, and this is about religious activities. So the question would be, to what degree are religious ceremonies or activities and traditions continuing, especially this coming, especially in this Ramadan, and are they thought to be a cause of the spread of the virus by the public already? So let me start with Pak Saiful. You mentioned about some of these cases actually come from those who attended the Goa, tablik akbar and things like that. So can you comment on that?
Right. Well, in Aceh, ulama or religious Islamic Religious Council itself, how do we say? We call it MPU, is like the MUI of Indonesia. Here in Aceh, we have this MPU, who declare actually they are not in line with the announcement or the fatwa from the national MUI that suggests to avoid prayers in congregation, salat berjamaah in the mosque. The Aceh Ulama Council actually said otherwise, that it is okay if it is if your neighborhood or your region is not a red zone or there is no confirmed case. So our religious organization, especially the MPU, said that it's okay to continue doing the congregation, which is it's many people say this what we call something that we don't actually want to have such a fatwa from our local religious scholars. But other smaller, other religious organizations such as Muhammadiyah in Aceh is following what the national Muhammadiyah organization fatwa or policies, urging people to avoid congregation as much as possible, and a different take on this. But so far, the mosque or the masjid in Aceh, some still practice the Friday prayers in congregation. Some with caution, practicing the distancing and bringing their own praying mat and wearing masks. But some don't actually practice any of this restriction. So it is very worrisome. And in terms of returning religious students, yeah, we are seeing more in the last week. That's where we have this 6 last confirmed case.
Thank you, Pak Saiful. Sudirman, do you want to add to that?
Yeah, I think it is very interesting that we both discuss about the Goa cluster, the recent large gathering among these tabligh jamaah in Goa, the neighboring district of Makassar, and the spread of this COVID-19 related to Goa cluster can be found in Aceh, but also in other provinces, several provinces in Kalimantan, and also the West Nusa Tenggara province in the eastern part of the archipelago also mentioned some cases that they found in their provinces related to Jamaah Tabligh cluster in Goa. And also, interestingly, the Magetan cluster also affect South Sulawesi. In fact, several new cases in several districts in the northern part of South Sulawesi province, Bone and Sinjai, reported new cases possibly related to Magetan cluster. And like in Aceh, the contribution of Islamic organization, particularly the mainstream Islamic organizations, to encourage the people to comply to government's regulations, including to practice prayer at home during this holy month of Ramadan, tend to be followed by a larger mosque in Makassar. But the influence of the fringe Islamic organizations cannot also be ignored, particularly among smaller mosques in Makassar. Several smaller mosques still organize Taraweh, or the night prayer during the holy months of Ramadan, and breaking the city and provincial regulation for the large scale social restriction. But at least, if I have said, these mainstream Muslim organizations contribute positively to the preventative measures advised by the government.
Thank you, Sudi. So next I will pull the questions from Yogi and Catherine, and that is about the preparedness of health systems in the local levels in province and district. And as Yogi pointed out, in light of the decentralization policy, the health authorities have been transferred to local governments. Do you think they are ready to with these authorities to deal with especially COVID-19? Maybe Pak Saiful can go first.
Yes, thank you, Pak Chow. Well, Aceh just had its own testing lab in Balitbangkes of the ministry. It's actually owned by the Indonesia National Ministry of Health, but they have this office in Aceh, and we just had this test lab I think about 2 weeks ago, before all the tests to be done in Jakarta, and that's why it was more worrying before, because we have to wait 4 days to 1 week to confirm the case. But now we have the test lab here in Aceh, owned by the Ministry of Health also. There is another lab proposed by our university, but it was not running yet. I don't know what happened. But in terms of the capacity of the local government, to my knowledge, all district government has their own task, already formed their task force and reallocating budget for COVID responses. We have hospital and regional hospitals, district hospital and regional hospitals, as well as the main hospital in the capital city, where the patient is treated. And so far, it has never been over crowded by the patients of the COVID-19. And even if in the cases that we don't have enough or good infrastructure, health infrastructure, some people argue that is why Aceh has this quite big reallocating budget of 1.7 trillion rupiahs, because some will be allocated to make sure that we have a better infrastructure to cope with the pandemic.
Thank you, Pak Saiful. Pak Sudirman, do you have any addition?
Yeah, it is also the case in South Sulawesi in the early March when the national government announced the first cases, and it is an alarming sign also for the provincial and city governments in South Sulawesi to respond. And for our health system, it is also a time when there is a rapid mobilization for testing in several facilities in Makassar, particularly several laboratories organized under the Faculty of Medicine, Hasanuddin University, and also the Hasanuddin University Hospital. And there are several resources available, particularly due to our experience with SARS and avian flu in the previous years, and also due to the close collaboration between Hasanuddin University and the Ekman Institute in providing several basic infrastructures and also human resources for testing. But for treatment, since March, we increasingly experience an overwhelmed local health system because the rapid and the growing number of people coming to the hospital. So our colleagues, medical doctors and nurses and other health workers in several big hospitals in Makassar start to be overwhelmed in the last few weeks, and particularly with the limited availability of protective tools. And several medical doctors and nurses were infected and confirmed as COVID-19, including actually the former Vice Chancellor of Hasanuddin University, a medical doctor and a professor in medicine, who was tested and confirmed as a COVID-19 case. Fortunately, he recovered and also experienced no major clinical symptoms.
Thank you. I think you both also have answered question from Fania about, whether or not the local governments also chip into the budget in response to the COVID-19. So, for example, Pak Saiful already showed a figure of a big figure for Aceh province government to deal with the COVID-19. So, Fania, your question was answered. So let me go back to other question. There is a question from Pak Priyono, which is also this similar question from Esther, and that is about the effectiveness of this distancing, either lockdown policy or PSBB. Before I go to you, I would like to invite Pak Priyono to check our recording from 2 or 3 weeks ago. We talked specifically on this issue about lockdown policy. But let me turn again to Pak Saiful. If you have any say on this lockdown or PSBB policy in Aceh?
Well, so far Aceh has not been under lockdown or PSBB. There are limited lockdown initiated by villages at a village or kampung level. And some district, kota and kabupaten also check visitors coming to their region, especially in the hinterland where there is only 1 or 2 main road to enter and exit the district. They do roadblocks to check people entering the cities and kabupaten, the district. But the so-called lockdown is actually initiated by villages, by kampung, at a very small kampung neighborhood level. And initially, I think this also related to the question from Sharifah, Bang Aco, if I also might address that.
All right, yeah.
Initially, everything is started and initiated by the people in the kampung or in the village, and they self-provide the basic needs of everyone and make sure that everybody in the village have their own basic needs provided. If they don't have enough, then the neighbors will contribute together. Some village already started their old style lumbung padi or lumbung beras, while in Aceh there is actually still going on in different form, and now it's actually maybe emerging or re-emerging within the society, and to that extent, I would say the social capital has been strengthened. But after the national policies involve, for example, the discussion about using the dana desa, the village fund, transferred from the national government and from the provincial government, and once the village fund is allowed to be used also for COVID response in village level, then I think we start hearing noises and different voices about how to deal with the fund provided by the government. So in a friend, for example, saying that is in the end, the village is actually really the fort for the people, benteng untuk masyarakat. So everything done at the local level and seems to be running quite smoothly. I think because the Acehnese have this experience before, not to depend on solely on the, at least not to depend solely on the government aid. And it was actually more initiative until then the government decided that you know, they have allocated more funding, and now people are talking about where the funding, where is the funding, who get how much, and why there is some people get some and others don't, which we never actually heard before when the initiative and the people are taking the action into their hands.
Thank you, Pak Saiful. Sudirman, do you have a take on the social capital, whether or not this PSBB enhance or weaken the social capital in the region, in our beloved Kampung, Makassar?
Yeah, I think it is also the case in South Sulawesi in the early weeks of March, where we saw the slow response from the government, particularly to anticipate the economic and social impacts of the epidemic. We start to see increasing number of societal organizations took earlier and more promptly initiatives to organize themselves. In Makassar, we start to see two emerging trends of this community movement. to provide donation and also support for the health workers in several hospitals, and also to allocate aid, particularly with basic necessities for the people below the poverty line. And it is mostly organized locally. So I think we can confidently say that Indonesia's social capital is there, and sometimes it is more reliable compared to government initiatives. But also in the last few weeks, we start to see increasing improvement in the government initiatives. A few days before the implementation of a large social restriction in Makassar and also Goa, we start to see the coordination between the provincial and city district government to be strengthened in South Sulawesi, and also the line of communication between the government and the universities, and also with religious organizations. So I would like to say that the challenges are still there, and we need to anticipate the peak of the epidemic in the coming few weeks. But also we start to see some good signs in terms of improvement in responses, both from the government and also from the community level.
Well, thank you. I think we have answered all the questions, but in the interest of time, let me take one more question, and this is very interesting from Cam Noble. In Australia and the US, there have been reports of crackpot cures for COVID. So, obat abal-abal, you may call it, right? So, do you observe this in Aceh or in Makassar, Sulawesi also? Pak Saiful.
Well, I think hearsay, gossip, some people say, or even actually in academics from my own university say that marijuana actually can help, or I don't know, can cure the COVID. It was in the news for a while, but I think it was dismissed. I don't know whether any Acehnese take that into serious account, and but yeah, and they also because Acehnese are very proud with their old literature. They also try to see what the ancestors are doing in these cases, where we have this what we call ta'un in Bahasa Aceh or in Acehnese, that come actually from Arabic word ta'un, which is also in Quran, in the Al-Quran actually, and the Acehnese word is very close to the Arabic word ta'un, and there are some articles in the media reporting about what the older generations done in several cases, but because it's not clear whether it's the same case or not, people just, I think, read it for fun or to know that what happened, the COVID-19 is actually, although it's of course it's a new pandemic, but similar cases has happened before in the past.
Okay. Pak Sudi?
Yeah, in Makassar, what I observed in the last few weeks, it is mostly related to a kind of overstating the effect of several food or substances. For instance, many people advise particular kind of fruits or vegetables. Some claim that these may weaken or defeat the virus. Some other manage to explain a more proper explanation that these particular fruits or vegetables or foods may contribute to strengthen body immunity better prepare individuals to overcome the infections. But overall, several organizations, medical and also health organizations, provide some clarifications. A more worrying part of this hoax or infodemics is actually related to the conspiracy theories in relation to the origin of the viruses that may trigger racism or discrimination toward a particular group of community in Makassar or in South Sulawesi, or exacerbating stigma, the existing prejudice to particular groups.
Well, thank you so much. I think our time is up. Thank you again for both Pak Sudirman Nasir and Pak Saiful Mahdi for very interesting discussion. And I thank also all the attendants. Thank you for attending the webinar, and we hope to see you again in the next webinars. So over to Nuka.
Hi, thank you everyone. I just want to say something about next week's seminar. We will have Dr. Ines Atmosukarto from ANU, who will talk about vaccines and drug policy for COVID-19. And we will also have Anindita Gabriela from the UNSW and Aditya from AIDS Coalition, who will talk about the rapid survey for people living with HIV and AIDS in dealing with COVID-19. And thank you. That's it, I'm going.
Thank you.
Thank you.
Okay, thank you, everyone.
Yeah. Thank you.